You'll meet the receptionist first, who will simply just ask you to take a seat in order to wait for the orthoptist to see you. The orthoptist is a technician who's been trained specifically in doing eye tests and actually knows a lot about retinal problems as well. The orthoptist will measure your vision, test your eye with a scanner called an OCT scanner. That gives us a cross-sectional image of the retina, a bit like a brain scan. They will then put some drops in your eyes, anesthetic drops. The drops make your eyes numb, and you only need a few of them to make the eye numb enough for an injection. One of the biggest risks of injections is infection, so we take that seriously and put antiseptic in, as well as take all other precautions. Within about 15 minutes or so, your eye will be ready for an injection, and then you'll come into the injecting room, where you'll be sitting in a chair that leans backwards, and you'll have something to look at on the ceiling. There's a target. And what that does is it makes you keep your eye absolutely still so that we don't have a moving target when we're injecting. And then we hold your eyelid open and do the injection very quickly. The purpose of all of this is to get the drug into the eye with the least amount of discomfort and as efficiently as possible. The quicker the injection, the more comfortable it is usually. Once you've had your injection, we put some gel in your eye, and that lubricates the eye so that the eye's comfortable straight afterwards. And we give you some gel to take home with you. Usually you need to use that a couple of times, 1 hour, maybe 2 hours after the injection, and then more if you want to. In fact, the best thing you can do after an injection for an hour or two is to keep both eyes shut. After that, your eye usually feels a little bit irritable for the rest of the day, but just slowly gets better and improves. The important thing though is that if your eye begins to feel more uncomfortable later on, or your vision gets worse in any way, you really need to get in touch straight away. The reason being that when you have an injection, the most important risk is infection, and it's important that we know about it straight away.